Each new school year brims with possibilities as Harvard medical students don the iconic white coats of their chosen profession for the first time. This year's incoming class is joining a community committed to realizing the promise of modern medicine, a community devoted to training the next generation of physicians and scientists to be problem solvers and leaders. HMS continues to lead education innovation, evolving its MD, PhD, and master's programs to prepare students for the challenges of a shifting biomedical landscape. New students are arriving to classrooms of the future, which include interactive whiteboards and patient simulation technology. They pursue knowledge by creating it as well as consuming it through a new Scholars in Medicine program that pairs them with faculty mentors.
So my Scholars in Medicine project is about how patients who do not have primary care providers use urgent care and emergency room services. The data that I'm generating is going to help create a product that can actually improve how we provide primary care to our patients.
To further enhance the curriculum, faculty members developed a capstone course that prepares students for the transition to internship following medical school, when freshly minted MDs encounter challenging clinical situations and intense emotions. After a successful pilot, the course is being offered to 50 graduating students next spring. Home to the largest medical faculty on the planet, HMS also nurtures research that's stunning in its breadth and scope. Scientists work on campus and at the school's 16 affiliated hospitals and institutes to explore the machinery of life and probe disease, making discoveries that reverberate across the nation and the world. In the past year alone, investigators observed cholera's infectious weapon in action, reconstructed mammalian brain circuits, analyzed colon cancer genomes, designed a nanorobot that targets specific cells, built the largest protein interaction map to date, and more. To translate such research to the clinic, HMS convenes multidisciplinary teams. The idea is to harness expertise from across the community to accelerate the development of new treatments. The Harvard Clinical and Translational Science Center, also known as Harvard Catalyst, recently awarded pilot grants to 7 teams for research on a variety of child health issues, including diabetes, asthma, and autism. The new Systems Pharmacology Initiative brings together basic scientists and clinicians with computer scientists, physicists, and mathematicians to transform drug discovery.
The unique advantage of Harvard Medical School is that it brings together a diversity of talent and experience from basic science to translational research in order to provide the new approaches to discovery and development of new therapeutics.
Our compass is a question. It points true north, and that question is, how will it help the patient?
Members of the HMS community devote their careers to improving lives locally, nationally, and globally through teaching, research, patient care, and advocacy. Collectively, faculty, staff, and students are on a quest to advance human health. Despite an explosion in biomedical knowledge, major barriers remain to alleviating suffering caused by disease. Harvard Medical School is working to overcome some of the obstacles through programs that foster innovation. One new initiative takes aim at the nation's primary care crisis. The Academic Innovations Collaborative, launched by the school's Center for Primary Care, will infuse local practices with $12 million in funding, enabling them to develop and test strategies to transform care delivery. The initiative resonates with faculty in the HMS Department of Healthcare Policy, who recognize that new models are needed to reduce costs while improving outcomes for patients.
I think our approach is twofold. One is to do fundamental research that will be unbiased and will actually bring new data to the table for decision making. The other approach is to be there in an advisory fashion when decisions are made or advice is requested.
Harvard Medical School also inspires change that ripples around the world via strategic partnerships. A new Master of Medical Sciences program in global health delivery provides training in the design and improvement of health services, especially in resource-poor settings. The school is also working with academic institutions and governments on multiple continents to enhance research and education opportunities for local doctors and scientists, as well as for HMS students and faculty. Ultimately, patients will reap the rewards of these collaborations.
Members of our community are making remarkable progress on a number of fronts. Thank you for all of your efforts in patient care, education, and research. Have a happy and productive year.